Yeah, it's recording.
Start. Okay, come on, Tim. Show Jim, Tim.
Alright.
Okay. My name is Sinead Bagley, and I'm doing my informative speech over smallpox. Again. Okay. Smallpox is one of the worst viruses to ever affect mankind. This disease, which starts with a rash that progresses blisters and can cause disfiguration, blindness, and even death. It first appeared in settlements in northeastern Africa around 10,000 BC from the Egyptian merchants. From there, Egyptian merchants spread it to India. The earliest evidence of smallpox was found on skin lesions on the faces of mummies from the 18th to 20th Egyptian dynasties. Also, the well-preserved mummy of Pharaoh Ramses V, who died in 1157 BC. The first recorded smallpox epidemic happened in 1350 BC during the Egyptian-Hittite War. In 430 BC, the second year of the Peloponnesian War, smallpox hit Athens. There it killed more than 30,000 people. This reduced the population by 20%, and an Athenian aristocrat provided a terrifying account of the epidemic. He described the dead lying unburied, the temples full of corpses, and the violation of burial rituals. He wrote, "The sick and dying were tended by the pitying care of those who had recovered, because they knew the curse of the disease and were themselves free from apparitions. For no one was ever attacked the second time, or not without a fatal result." These Athenians had become immune to the plague. In Greece, Athens was the only city hit by the epidemic. However, Rome and many Egyptian cities were affected. Smallpox then traveled along trade routes from Carthage. In 1910, Rhazes wrote the first medical description of smallpox, saying the illness was transmitted from person to person. This explanation of why survivors of smallpox do not develop the disease a second time is from acquired immunity. The patterns of disease transmission often parallel with people's travel and migration routes. Disease in Asia and Africa spread to Europe during the Middle Ages. Smallpox was brought to the Americas with the arrival of the Spanish colonists in the 15th and 16th centuries, and it was widely acknowledged that smallpox infection killed more Aztec and Inca than the Spanish conquistadors, helping to destroy their empires. Smallpox then continued to ravage Europe, Asia, and Africa for centuries. In Europe, the disease accounted for nearly 400,000 deaths each year, including 5 kings. Of the survivors, 1/3 were blinded. The worldwide death toll was staggering and continued well into the 20th century, where mortality has been estimated at 300 to 500 million. This number vastly exceeds all the world wars. Violation, the earliest smallpox vaccines. The idea of intentionally inoculating healthy people to protect them against smallpox dates back to China in the 6th century. Chinese physicians would then ground dead scabs from smallpox victims along with musk and apply the mixture to the noses of healthy people. An English woman, Lady Mary Wortley Montagu, is responsible for introducing violation to England in 1717 while accompanying her husband, the British ambassador to Turkey. In Constantinople, she came across the ancient Turk practice of inoculating children with smallpox matter. At first she was horrified, but then she learned that a child was protected from the ravages of smallpox through this process. She then had her 6-year-old son inoculated while in Turkey, and in 1721, in the presence of the Royal Society members, she had her daughter inoculated. This led to the adoption of violation, mainly by the aristocracy of England and Central Europe. Before long, violation to prevent smallpox was widespread. During America's War of Independence, George Washington had his army treated this way, and so did Napoleon before they invaded Egypt. The global campaign against smallpox ended in 1979. 2 additional cases of smallpox occurred in Birmingham, England in 1978 after the virus escaped from a laboratory. There has not been a reported case in more than 25 years. Variola is the cause of smallpox. Smallpox is caused by a virus, and can result in one of two forms of the disease called variola major and variola minor. Variola major kills 20 to 40% of unvaccinated people who get it and can also lead to blindness. Variola minor, less lethal form of disease, only results in death on rare occasions. The disease is transmitted primarily by direct contact with droplets from saliva and other bodily fluids. They travel through the air, such as through a sneeze. It may also be spread if an unaffected person handles clothing worn by someone with smallpox. The incubation period for smallpox is 8 to 17 days, with people usually getting sick 10 to 12 days after infection. Symptoms start with malaise, fever, rigors, vomiting, headache, and backache. The trademark smallpox rash appears in 2 to 4 days. The smallpox vaccine currently licensed in the United States is made with a virus called vaccinia, which is related to smallpox. It does not contain the actual smallpox virus. This causes the body to produce antibodies in protecting against smallpox and several other related viruses. The CDC is the only source of smallpox vaccine and will provide it to protect laboratory and other healthcare personnel at risk for exposure. A reformulated vaccine is now under development. What would happen if there were a smallpox attack today? The CDC smallpox response plan calls for immediate isolation of confirmed and suspected smallpox cases and tracing of vaccinated people who have been in close contact with the smallpox patients while they were contagious. But depending on the size of the outbreak, state and federal officials might order vaccination of everyone in areas with confirmed cases and might impose quarantines in some places. This has been my speech over smallpox.
How we get an A or B?
Alright, let's make it full screen again. I'm hot.